Hey, what's up, everybody? This is Maggie Reichart, and welcome back to Nursing Uncharted. Thank you guys so much for listening. And before we get started, I just wanted to let you guys know AMN is giving away prizes right now just for applying and following them on Instagram. Head over to their Instagram at AMN Nurse, click the link in their bio, and then click Your Passport to New Horizons. If you fill out their checklist for getting started, you can win Amazon gift cards and new scrubs and a lot of great stuff. So head on over there if you are interested in traveling. We have a great episode for you today. This episode is going to split its focus into a couple different topics, which we haven't done before. So the first focus will be on float pool nursing or staffing resource nursing, which is kind of like the hospital's set of permanent travel nurses. And the second focus is going to be on nurse educators, specifically in, classroom and clinical instructing. So here to shed light on these avenues of nursing is Irene Aghahowa, the nurse who does them both. Irene has been a nurse for 13 years now. Her educational background includes a BA in biology, a BSN in nursing, an MSN in education, and a postgraduate master's degree in public health. Her clinical background includes adult acute care in cardiovascular thoracic nursing and medical surgical nursing, long-term care, clinical inpatient case management, and nursing education. So Irene, welcome to the show.
Thank you, Maggie. It's a pleasure to be here. Thank you thank you for having me. I'm honored.
Absolutely. Irene and I used to work together in the float pool, and float pools you don't normally get to work with other people in the float pool, but COVID units are normally staffed with all float pool nurses. So we were able to work together a few times.
That is correct.
So I'm happy to be talking to you today.
Likewise, Maggie. Bring it on, girl.
Yes. So nurses know what a float pool nurse, and we may use float pool and staffing resource or SRO interchangeably in this episode, but we know what SRO nurses do because it's the same job expectation as floor nurses, but not many people know or understand what being in the SRO is actually like or how it might differ from floor nursing. So can you explain just some of the background details of being in the SRO?
So for clarification, SRO stands for Staffing Resource Office. Mm-hmm. So pretty much it's a resource of nurses from a variety of backgrounds. You have acute care nurses like myself, you have ICU nurses, you even have ancillary staff like companions, patient care associates, or they call them CNAs now, so pretty much, our role is to help staff and support other units, including the emergency department. So I'm specifically an acute care nurse, so I get to flow to acute care units.
Yeah. And how do you normally get your daily assignment? Because normally in floor nurses, they will just come to the unit, but it's a little different with SRO.
Absolutely. It's different from SRO. So my understanding is that with SRO, there's different levels of staffing. We have travel nurses. We have people who are full-time with SRO. I personally am part-time, or what's called wage. So we utilize the resource Chronos. We go in there, we create our own schedule as long as we meet the minimum requirements. So we go by schedule periods, and these schedule periods are 6 weeks. And so the minimum requirement is as long as you work 72 hours. Obviously, with COVID, those requirements increased. They used to be 36. They doubled it because of the increase in staffing needs and demands.
Oh, I didn't know that.
Yeah. So
even for part-time?
Even for wage, yes. We are all required now to do 72 hours in that 6-week period. And that includes 2 weekends. And then we also have to fill in for holidays, both minor and major holidays. So we just go into Chronos, put in our schedule. Me being a nurse educator right now, full time, I just work Saturdays right now. It works for me because that way I'm able to meet my requirements, and I'm able to meet the weekend requirements as well.
Sure. Yeah. Gosh, that's got to be so tough, because I was just thinking about that, because I mean, when you're part-time because you have the second job, and now you have to have this minimum 72 hours is...
It's a lot.
2 weeks. It's 2 weeks essentially, or 4. Yes.
So it depends
Like
on how
full
you do it.
nursing
Like for me, I work every Saturday right now, so mine is stretched the whole 6 weeks. But someone
I
else,
see. Okay.
I mean, and I've done this when I have time off from PVCC. I worked 3 shifts back to back, and I was able to have a couple of weeks off here and there. I even at some point had a 6 week vacation stretch of time. So
Okay.
yeah, as long as you meet the requirements in that 6 week window,
Sure.
how you do it is up to you.
Is up to you.
Yep.
Okay.
Yep.
What is the chain of command like? Like, how often do you see managers? Like, do you guys have meetings or anything? Or is it pretty, like just individual based?
Absolutely, Maggie. Good question. So right now with SRO, I believe we have about 3 to 4 managers, and each manager covers a certain group of staff. So for me, being an acute care SRO nurse, I have a manager that manages us. We have another manager that manages the critical care nurses. And then we have another manager that covers ancillary staff, health unit coordinators or HOCs, the patient care companions, and the CNAs.
Okay.
So obviously the managers are our first line in the chain of command. And to my understanding, we also have a director as well.
Okay. Gotcha. Cool. What do you think are some of the major differences between nursing in the float pool and floor nursing in regards to our nursing experiences? I mean, I know that we kind of talked about, how SRO nurse has been affected by nursing shortages. And that's kind of speak to that a little bit.
Yeah, SRO has definitely been impacted by the nursing shortage, and so has all health organizations, including floor nursing or floor nurses. In my perception, the major difference is as a float nurse, you're floating around to different units. As a floor nurse, you get to belong to a particular unit and a particular unit culture. That's the biggest difference. So I kind of see both as distinctive in its own way, and it's a matter of individual preference and needs.
Yeah, very true. I mean, because right now, a lot of people are looking to kind of break away from that unit culture. And I feel like you can find that in the SRO. Like if you're looking for a little bit more autonomy, freedom, just to like make your own schedule, like just do your 12 hours and go home.
Exactly. Exactly.
Or if you have a second job like you, I mean, if, just being able to kind of make that work for your schedule.
Absolutely. So you hit the right notes, Maggie. Being a float nurse definitely gives me that autonomy to manage both being an acute care float nurse and a faculty. Absolutely. Yep.
Do you feel like SRO nurses are kind of subjected to difficulties of the hospital more so than floor nurses, just because, you are going to the units that are the shortest staffed that day?
Maggie, that's an interesting question. I think it also depends on the angle with which you're looking at it. I would... It goes both ways. I think that floor nurses have their challenges, and I think that float nurses have their challenges. And what's common is that you're a nurse and you're experiencing the shortage. We're all experiencing what COVID is doing, the challenges that COVID brings. I feel like as a floor nurse, of course, you are attached to a particular unit. You have strings. So there are certain expectations to the organization itself. As opposed to being a float nurse, you're not attached to a particular unit. So there's a little more of autonomy and flexibility. But I think either way, we're all going through the same challenges, nationwide.
Yeah. Yeah, that's very true. I just figure, I don't know, so when I was in the SRO, I was in the SRO for maybe 6 months or so. And I felt like, every day, you kind of are, I mean, you go to the unit that had call outs that are having, low retention rates and you kind of will go to the same ones over and over. I guess in my case, I was in SRO the 6 months that COVID was surging. And so I was in the COVID units most of the time, but I feel like floor nurses are kind of shielded from that in a sense that if you're not on one of those units, I think as an SRO, you kind of have to be okay with that kind of chaos that might come with the short staffing that you're experiencing on a day-to-day.
That's true, Maggie, but I also spoke with floor nurses. I mean, they were having a difficulty. They were floating them as well. I mean, I met floor nurses that were coming to SPEW. And when I say SPEW, special pathogens unit or to the COVID unit, I mean, and they were floating to the ED, like wherever they were needed. So that's what I'm saying is that regardless of whether you were a float nurse or a floor nurse, we all experience the challenges. And from what I also learned from floor nurses is that for those of them that unit culture meant a lot, that whole floating around and moving around and, changes in the staffing population and all that, it really disrupted that unit culture. And there were nurses that took that very personally. Yeah.
I remember that before I started travel nursing, I hated floating. It was like, I would be so upset because it does. You're right. It disrupts it disrupts your whole day. Like you don't know how another place works. And, it's a completely different, you're going in thinking you're going to have one day and then you have something completely different. Exactly. And if you're not used to that, then it can like ruin your whole day.
Exactly. And I think one challenge about being a float nurse is that you're coming to a unit and you're foreigners into that unit. And, there are different degrees of acceptance. I don't know if that makes sense. Some units were more welcoming than others. And then also the team collaboration also varied as well.
Yeah. I wanted to ask, do you feel like SRO sometimes gets a little bit harder assignments sometimes? Like what's your experience been with that?
That's a good question, Maggie. I have experienced a mixture of it. I have had experiences where I'll go to a unit and I am given a different assignment because I'm not an expert nurse in that patient population. Sure. So an example is if I floated to like a neuro unit, they wouldn't assign me to a patient that's on continuous, monitoring because EEG, thank you. Yes, exactly. Or if I floated to an oncology unit, I wouldn't be able to give chemotherapy drugs. Yeah. So the assignments will be different. Exactly. And there were other times that I would experience that because I was that outside nurse coming in, I might have a more challenging assignment from, the indigent nurses on that unit. But regardless of what it is, as an individual nurse, I've always told myself, regardless of what it is, stay positive, be open, do what I got to do, engage in team collaboration regardless, embrace it, and do what I got to do, be professional.
Yeah, absolutely. I think I've seen a mixture too. I've been charged on inpatient acute care units before, and you are required to give those specialized patients the nurses that are specialized in that. But sometimes there were patients who have been there long term, or they've been rotated because they are manipulative or dangerous or whatever the case, and you find yourself maybe getting those patients that have to be offloaded to the floor staff.
Correct.
And that was always kind of, it's necessary, but at the same time, when you're floating every day, it's are you getting those patients that the nurses were trying to offload every day to different places? That's exhausting.
Absolutely.
We want to take a quick break from this episode to talk about the industry leader in travel nurse staffing, American Mobile. Combining the largest network of facilities and providers in the country with top-level benefits like higher earning potential, premium health insurance, and 401k matching, American Mobile puts you in the driver's seat of your travel nursing career. Make sure to visit AmericanMobile.com today to discover a world of adventure with American Mobile. That's AmericanMobile.com, the first step towards your next travel nursing adventure. What are, in your opinion, are some of the, well, we kind of talked about some advantages and disadvantages of float pool nursing, but let's expand on that. I mean, having the freedom to make your own schedule, working the hours that you want, not being tied down to any expectations. Do you have any kind of stories maybe that just kind of enhance advantages of SRO, or maybe the opposite, disadvantages of SRO?
Wow, Maggie, you put him in the hot seat here. I think I've pretty much touched on generally on the advantages of being an SRO or float nurse. Mm-hmm. I think the challenge, I don't want to say disadvantage really. One of the challenges is you don't know what unit you're going to get floated to.
Yeah.
And I'm sure you agree with me, Maggie, is that as a nurse, we all have our preference on certain patient populations. Like me, med-surg, cardiac, thoracic. Yeah. So, of course, when I'm floated to a neuro unit, it's like, oh my goodness.
Don't give me those patients.
Yeah, don't give me those patients. You know what I'm saying? But, you do the best you can under those circumstances. And another challenge is I did have an experience where I had started an assignment on a unit, and then halfway through, they're like, okay, Irene, we need to pull you off this unit and go to another unit. That can be frustrating because you've started your day, you've acclimatized to the unit and the acuity of the patients you're dealing with, and then it's disrupted. Now you have to go to another unit, learn a different patient assignment, and get into that flow again. So that's definitely a challenge that comes with being a float nurse. But I understand, again, that's what our major role is to meet acute needs, So, acute staffing needs. So,
yeah, I forgot about that too. That's you. You're the float,
Exactly.
But it can be, we try, I feel like floor nurses, charges, they try not to do that. But I mean, when there's a need, like you said. So I feel like you have to be, if you want to be in the SRO, you have to just roll with the punches and be very versatile.
Absolutely. You hit the nail on the head, Maggie. You have to be versatile and be prepared for anything. But recently I've been pre-assigned to a particular unit. I've been doing charge there. So that's been good. I've not had to float around much.
Okay. Is SRO still staffing the COVID units pretty much?
Yeah, because as you know, the COVID cases are rising again, especially with the variants. So yes.
Yeah. Yeah. COVID, man.
I know. Here we go again.
I know. Yeah. And this time we're not going to get to work together because we're in the ICU now. But do we still just have one unit open where we're at?
So my understanding right now for the acute COVID patients, there's one unit, and then there's another one, which is the overflow. And that particular one, sometimes, from what I'm understanding, part of it is acute and part of it is also ICU for the overflow from the COVID ICU unit.
I see. Yeah. Okay. Well, because from the ICU point, we have our whole unit is no longer medical ICU. It's all COVID, and all of our medical ICU patients are being diverted to other ICUs. Exactly. And then we just opened up a second floor for overflow patients for that. So we may have 4 right now.
Wow.
3 or 4. Yeah.
Wow.
Yeah, it's back, man.
Yeah, it's tough. It's tough.
Yeah.
Yes.
Have you ever, SRO obviously works for you right now. Have you ever considered moving over to floor nursing, or do you think that SRO, you like where you're at?
I think for now, I'm happy with being an SRO nurse because, like you hit the nail on the head, I'm happy with the autonomy that it gives me, considering that I'm also a full-time faculty. So yeah,
Yeah.
gives me that flexibility that I need right now. Maybe in the future I might change my mind and go back to being a floor nurse, but right now this is good. This is working for me.
Yeah. I think a lot of people are looking for that right now, like looking for a job that's working for them rather than something that they have to like fit their mold to, you know? And so SRO just has seemed like very attractive in that way. It certainly was for me, you know, but I mean, there's a give and take. There's pros and cons for both.
Absolutely, exactly. And that's why I said earlier, right? It's a matter of individual preference and needs. What suits your schedule right now as an individual nurse? Yep.
Let's get into nurse education and instructing. So you are a nurse educator for undergraduate nursing students, right?
That's correct.
And are you doing both classroom and clinical right now?
Yes, that is correct.
Okay.
Doing both classroom, which we call theory or didactic, and then also clinical instruction.
Okay. And I haven't been to nursing school for, you know, a while now, but we were talking about before how schools are using a new method of curriculum called concept-based curriculum. Can you just explain what that is and how it's different than what used to be taught?
Absolutely. So we transitioned from the traditional curriculum, which we felt mimicked very much the medical model, and transitioned to a concept-based curriculum, which is a lot more nursing friendly. So now we took the information from pretty much looking at it from systems point of view, and now we're looking at it in terms of concepts. And so it's more digestible right now for students, and it's easier for us faculty to teach as well. And also clinically as nurses, we've been doing this. When we're dealing with a patient, we apply concepts. It's like, okay, oxygenation, communication, right? So we just brought that ideology to the classroom, and it's really making a lot more sense for the students.
So what type of, like, name some of the classes that you're doing now?
Okay, that I'm specifically teaching in, or
like that's part of this concept-based curriculum.
So all the classes right now are part of this concept-based. You remember, Maggie, in our time when we were in nursing school, we took pharmacology as a standalone course. In this concept-based curriculum, pharmacology is no longer a standalone course. It's now like broken into concepts and applied with each course as it applies to the particular course. So for example, right now I'm coordinating and teaching health assessment. So we're learning in concepts, communication, oxygenation, sensory perception, things like that.
Wow.
Yeah.
That's so different.
I know. And Maggie, would you agree with me, for example, the concept of oxygenation? Would you agree that regardless of the course that you're taking, that oxygenation applies to everything?
I mean, yeah. It definitely does. That's going to be interesting. I wonder how we can kind of evaluate the, teaching strategy for nurses that are going to be coming in, like how they think differently.
Yes.
I feel like it's really easy for nursing, like new grad nurses, to be like very, like, I don't know, cut and dry and textbook and task oriented. And I wonder if that's going to help.
I think it helps. Yeah, I think it helps. I mean, I've spoken to students about it, and generally, they said yes, that they feel that this new concept-based curriculum is helpful. It's more digestible. It's more practical. So yeah, we're seeing great results with it. Yeah.
Do you feel like, so you'll have like one whole course on oxygenation?
Not the whole course, but there will be concepts in each course. You could have the concept of oxygenation in multiple courses. Okay. Does that make sense?
Yeah, it makes sense. So then I'm just curious as to what, like, how the courses are structured. Like do you still structure it like women's health?
Absolutely.
Pediatrics?
Yes.
Okay.
Yes, we still do it that way. but we just learn it in concepts.
Okay. Gotcha.
Or teach it in concepts.
Yeah. It's like such a, I can't even like wrap my head around. I'll have to like go to a class or something to understand like how I'm sure that it's taught so differently than how I was taught like 10 years ago.
It's the same material. It's
Sure.
broken down in concepts. Yep.
Yeah.
Yep.
Because the things that would stick in school was like how you would apply it.
Exactly.
Like, so I feel like, that teaching strategy must help students like really nail in like what they're trying to understand when you're thinking about it concept wise.
Exactly.
Can you explain some of the background setup of what your role as a nursing professor might entail? Like how much goes into, classroom and clinical instruction behind the scenes?
Absolutely. So, for example, as a course coordinator, got to make sure the course is developed to meet the students' needs, looking at the curriculum, the course schedule, the concepts, the structure, the overall structure of the class, making sure that objectives are met, meeting with other faculty. We look at our schedules, workload, putting students into sections. At the organization where I work, we have day cohort versus evening weekend cohorts, making sure that we have an appropriate number in each section or in each cohort. We also engage in professional development. We have to stay current in what we do.
Right.
And then also making sure that we're meeting accreditation standards. We deal with the Virginia Board of Nursing. We're dealing with ASAN. Things like that. And then making sure that we're meeting students' needs. And of course, sometimes, we might have students that present with challenging situations. And it's like, okay, as a faculty body, how do we best support the students? And what is his or hers best options under the circumstances and things like that. Yep.
Yeah. How often is class meeting now?
So it depends on the course.
Okay.
So, for example, with health assessment that I'm coordinating and teaching right now, we meet twice a week. Another course, fundamental skills, I think they also meet twice a week. I think most of the nursing classes meet twice a week. And then we have a professional course that is pretty much asynchronous. It's online, completely online. Yeah. So I think, from my understanding, all the courses right now meet twice a week.
Okay, good. What's the setup like? Like, how different is it now versus how it was last year?
So much better, Maggie.
Yeah, because I think when we were working together, that's what was happening. It was all online, and you're like, "This is a mess."
Yes. As you know, Maggie, nursing naturally is a profession that's based on really heavily hands-on skills.
Yeah.
Students able to have that interaction face-to-face with their instructors or faculty and having that hands-on. And so, of course, last year when COVID hit and we had to teach remotely, it didn't feel natural at all. It didn't feel natural. It didn't feel practical at all. Can you imagine teaching a course like health assessment?
Yeah.
That's majorly hands-on and having to do it by Zoom.
Yeah.
Yeah.
How do you even do, like, what does that even look like? Like, you're checking somebody's eyes and have them raise their eyebrows and checking their lungs. I mean, would they have to use their roommates? Like,
that's exactly. And it's interesting, Maggie. That's what we had to do. We had to Zoom our classes, lecture, and then we had the students record their assessments, and that's what they were doing. They were doing it in their rooms or whatever setting worked for them. It was challenging, both for students and faculty. It didn't feel natural. It didn't feel practical, So being able to come back to in-person status, or at least hybrid, where there could be a couple of classes that are done remotely or asynchronously as an online, huge, significant difference. Yep.
I'm sure the kids love it so much more too, because I'm sure it was frustrating. Like there are probably little things that little obstacles every day that you had to move past.
Absolutely. And there's nothing like, as a faculty, being there more accessible to students in person. And the students love this as well, to be able to get that one-on-one faculty guidance, especially when it comes to like skills, skills lab. It makes a significant difference.
Yeah. How do you even do skills over on, was there any courses that you were like, this is going to be too difficult to do over Zoom?
Yes.
Yeah.
There was one in particular, and it was skills, fundamental skills that they had to, regardless, they had to come on campus and do those skills.
Okay.
Yep.
Yeah. I was going to be like, there's no way. Cause you're so right. It's all so hands-on.
Yes.
We're talking about, patient interaction and like communication with people. And like,
exactly.
This is just not the medium that you can like really learn that on.
Exactly. But, thank God for the option of simulation. That became an effective optional learning modality for students. However, the Board of Nursing restricted how much simulation students had to have. And that makes sense, because simulation is a great supplemental way of learning, but it's still not real life, if you know what I mean. Yeah. So, we had to, prioritize depending on what semester the student was in, which group got to actually go out there and have hands-on versus those who had to do some simulation.
Yeah. Were they still allowed to go to clinical?
Yes.
Last year?
Yes.
Okay.
So that's what I'm saying. Like, depending on the semester, there was a semester where we had to prioritize the first years going in person to clinical. And then there was another semester where we had to prioritize the seniors, right? The second years going to clinical. Especially, and that was for the seniors, it was their practicum. They had to go to clinical and get that practical experience. They're about to graduate, that's critical. And then for the first years in their first semester, they had to have that fundamental skills experience.
Okay. Gotcha. I'm curious to know what the mindset of students are right now, like after seeing everything, kind of unfold last year and then also being affected by it in class. What have you felt like in your experience? Like, are you losing students right now? Like, are they withdrawing from the program or are they staying in? Like, what's their mindset right now?
Student retention has definitely been challenging. We've lost some students. COVID is rough. It's been tough on everybody. We've lost some students because of that, especially when we're remote. I mean, people are dealing with a lot. They got kids, jobs, and other personal stuff going on. Absolutely. And then now we're still dealing with COVID. And then we have the issue, the issue of vaccination. So, of course, as you know, people have personal ideology on vaccination. So that has also been a piece of it.
A challenge.
And being a nursing student, our stakeholders, clinical facilities are mandating that students must be fully vaccinated. And it's understandable because we need to be able to minimize risk, right, of infection, protect the students, protect everybody, their families, their loved ones. So,
So are they changing majors altogether, or are they like leaving the university altogether?
I've seen students who just leave completely, and some will change majors. Yep.
Yeah. I feel like you have such an important role right now, because even more so after last year in regards to retaining students, because, you're seeing, like, you still work in the hospital and you're the ones teaching this new batch of students. I mean, do you feel like your role has, as an instructor, like shifted at all, being like, it's a wonderful profession, like still, I know it looks bad.
Being an educator right now is it's challenging. We have to be more adaptive. We have to be more innovative, creative, because we are teaching in an era of a pandemic right now. You're also dealing with students that could be having a lot more going on, right? And you have to be creative in the way that not that you were not creative before, but now, you have to,
forced
exactly,
to be
even more so now, that we have to teach under these kinds of modalities. So absolutely, that's been a challenge. But, the beauty of being an educator and a clinician is that, I get to live in both worlds. And these worlds, they're codependent on each other. Right? So educators, we are relied upon to graduate competent nursing graduates, right? To go into the workforce. Our stakeholders, health facilities and organizations are dependent on us to graduate competent nurses. And then on the other hand, we're also dependent on them for clinical sites, right? To train these students, and then also for job offerings when they graduate. So there's that codependence going on. And then as an educator, as an individual, I love that I'm both an educator and a clinician, because being a nurse clinician, I get to keep my skills going. And that's part of what I like about being a float nurse, is that diverse experience. I get to bring that back didactically to the classroom, share my experience with the students. Students love that practicality when you're able to tell them real life stories, right? That are relatable to the topic and all that. So it's really good. I love it.
I feel like you're a great person to bridge that gap between what you teach in textbook and then clinical, your clinical experience. Like, have you gotten into situations where you've disagreed with what the textbook says and you're like, okay, am I going to teach them what it's really like, or if I'm going to stay with the textbook?
Oh yeah. And these students are so smart, and we're getting more and more diverse group of students from different backgrounds. And by backgrounds, I mean educational and different racial backgrounds and so on. So they're all unique. They're coming to the table with different background experience. And of course, the challenges are there. But it's also nice because they're bringing a lot to the table. And I'm telling you, if there's a discrepancy in the textbook, they're pointing it out to you like, hey, professor, what's with this statement over here? And as textbooks, there's sometimes errors that happen.
Yeah.
So as faculty, it's important, just like in the clinical realm, right, Maggie? We need to always stay professionally competent through continuing education. And as you know, nursing is based on evidence-based practice. So as educators too, we're always staying as on top of things, right? Current as possible. So absolutely making sure that the information in the textbook is as up-to-date as possible. We don't recommend textbooks that are beyond 5 years to students.
Sure.
And when there's a discrepancy, we definitely address it, let the students know this is not correct. It could be a typo or whatever. And even sometimes referring to the publisher and, letting them know that, look, there's a mistake here and all that, right? So,
It'll be interesting when, 5 years from now when we have like COVID textbooks.
I know.
Or something. Yeah,
exactly.
Last year, when they did, what's the class? ClinApps or clinical applications or critical care. Did they teach COVID at all? Or, did they kind of rope that in with ARDS?
Mag, it's so interesting you say that. So this spring that passed, I usually coordinate and teach a course that's advanced med-surg. And this past spring, what I did was I created a project for the students. We covered the concept, speaking of concept of oxygenation, we covered ARDS. And I incorporated COVID into it, and the students appreciated it, case studies. So that's part of the creativity and the innovation that I'm talking about that the faculty has to keep doing. And they loved it. It was practical. It was applicable. Absolutely. Yeah.
I'm sure they loved it. They're like, all this huge thing is going on right now. Everyone is learning about it. Like, let's learn about it too.
Exactly.
That's great that you did that.
Yeah. It was good. And I'm telling you, as faculty, we learn from the students as well. They're so bright. And like I said, they come from diverse backgrounds. It's just amazing. I strongly believe that education, learning is a collaborative process between faculty and students.
Yeah. I mean, yeah, it has to be. I'm sure that, I mean, there was so much information coming at us last year about like new things. I'm sure you were like, you know, students were like, well, I saw this.
Exactly.
You're like, oh,
exactly.
Like, I should look that up too.
Exactly.
How is it like balancing both jobs? I mean, I feel like you have so many hats. You have a float pool hat, nursing educator hat. Like, what is it like to manage both jobs?
Great question, Maggie. I think generally nurses, right? We wear many hats. That's the beauty of the profession, the flexibility that comes with it. But yeah, you know, it can be challenging, but like I said, I enjoy it. And time management is very critical.
Yeah.
And I think
absolutely.
it's an ever evolving skill for anybody, right? So yeah, I have to constantly manage my time between being an educator and being a nurse clinician. And as an educator, sometimes bringing the work home, grading, right?
Yeah.
Yeah. And preparing for lecture and stuff like that. Yeah. But I think what's really important is, do you enjoy your job?
Yeah.
Because when you enjoy your job, regardless of the challenge, you just kind of go with the flow of it. So I enjoy being an educator and I enjoy being a nurse clinician. So even though I'm wearing these different hats, I enjoy it. I embrace the challenges that come with it.
Yeah. Well, that's awesome. I know you're so busy.
I love it. I'd rather be busy than idle.
Yeah.
Right?
Yeah. I'm the same way. I don't know what to do with myself on my time off. Every day that I have off, I instantly fill it with, you know,
something
all
to
of these
do.
things. I'm like, I wish that I had more idle time, but at the same time, I don't know how to be anything else.
I think it's that nursing you, Maggie. You know, you're just constantly busy and engaging yourself with something. It's that professional nursing you. And it's awesome.
Yeah. Yeah. So, well, I think that we've covered the topics that we want to cover. Is there anything else that you feel like we should cover?
Maggie, I think that this has been great. I think you hit critical points. I think people need to hear how the pandemic is impacting nurses, nursing as a profession, and the nurses, especially as a float or travel or floor nurse, and in both settings, academic and clinical, because there's shortages going on. It's impacting everyone. And I really want to thank you for in partnering with AMN and creating this platform, you know, for a voice for, you know, nurses to speak and for a voice on what's going on. Thank you so much. I really feel honored to be part of this process.
Well, I'm really happy to have you on and to talk about both of these things. You know, they're both very, you know, I know float nursing is a very attractive position right now. And also, you know, nurse education is a route that a lot of people are interested in. And so it was great to hear about both. And it was great to talk to you again. I miss that we don't get to work together anymore, but hopefully we'll get to see each other at work soon. I know you're probably just a floor under because we're both working COVID right now. So.
Likewise, Maggie, I miss working with you, but hey, you know what? We're always going to be in contact, right? And I'm sure sometime in the clinical realm, we'll probably cross paths again.
Yeah, absolutely. I'll have to come downstairs.
Yes, that's right. I could come downstairs or you could come up. Either way, you know? Yeah.
All right. Well, I think we're going to end it here. But thank you so much for coming on and talking to me today.
Thank you so much.
We'll talk to you soon.
Thank you for having me, Maggie. See you around.
All right. Take care. That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.